And now we're going to move on to some ligaments. In particular, we're going to talk about the knee ligaments first. Now, there are several important ones you can see pictured on your screen right now. On either side of the knee, you have the LCL and the MCL. That stands for lateral collateral ligament and the medial collateral ligament. Now, the medial collateral ligament is going to attach the femur to the tibia on the medial side of the leg. And the LCL, or the lateral collateral ligament, is just going to connect the femur to the fibula on the lateral side of the knee. So medial collateral ligament, MCL, and the lateral collateral ligament, the LCL. Then inside the knee joint itself, you have two more. You have the ACL and the PCL. Now the ACL is the anterior cruciate ligament, and the PCL is the posterior cruciate ligament. These are important to remember exactly where their attachment sites are. Now, the anterior, or ACL, the anterior cruciate ligament, is going to have one of its attachments on the lateral condyle of the femur, and its other is actually going to be on the anterior surface of the tibial plateau, and that's why we call it the anterior cruciate ligament. So its two attachments are on the anterior tibial plateau, as well as on the lateral condyle of the femur. So it's going anterior to lateral. And then the other one, the PCL, posterior cruciate ligament, as its name implies, is going to bind to the posterior portion of the tibial plateau. That's why it gets its name. But instead of going to the lateral condyle of the femur like the ACL did, it's actually going to go to the medial condyle of the femur. So we've got to go medial condyle of the femur to the posterior tibial plateau. That's the PCL. So far we've covered the MCL, the LCL, the ACL, and the PCL. Those are your four major ligaments of the knee. Now in the knee there's also something called the meniscus, and there's both a lateral and a medial meniscus. Now the meniscus is a cartilaginous tissue that serves several roles. One is going to be to provide some structural integrity to the knee, so very similar to the ACL and the PCL. But it also serves to reduce friction at the knee joint, and also to sort of disperse the weight of the rest of the upper body as it sits on the knee to reduce damage to the knee joint over time. So it's sort of a cushion. Now, there are several important injury patterns you should recognize on step one with regard to the knee and its ligaments. A very common football injury occurs from a lateral force to the side of the body, so a player getting hit on the side of their leg, for example, and we call this the unhappy triad. And what this means is that you have damage to the medial collateral ligament, usually a sprain or a tear, also to the anterior cruciate ligament, or the ACL, and also to the lateral meniscus, not the medial, but the lateral meniscus. So MCL, ACL, and lateral meniscus is known as the unhappy triad. It's a very commonly tested football injury. In order to tell if a patient has torn the ACL, anterior cruciate ligament, there's a common physical exam sign you can test for, which is called an anterior drawer sign. And you basically grab onto the patient's leg, so you're talking about the shin or the calf below the knee joint, and while you're holding the femur stable, you pull that part of the leg forward towards you and away from the patient, so anterior to the patient. And if there's a lot of laxity in that motion, you call it a positive anterior drawer sign, and you can be pretty sure that the patient has torn their anterior cruciate ligament. Likewise, if you try to passively abduct or adduct the leg at the knee joint, if you have a lot of passive abduction, so very, very easily abducted, you want to be concerned about a torn medial collateral ligament. And likewise, if you have a lot of passive adduction or adduction, you want to be concerned about an LCL, or lateral collateral ligament tear.